Yeah.
Hello, I'm Dr. Bruce Lambert, and I'm here to talk about chiropractic and pregnancy. We've got Vanessa here, who is a patient of mine. She's 34 weeks pregnant, and she's gracefully volunteered to be our pregnant woman for this video. So, first thing I just want to show you is that we have this pillow that's cut out to cradle the abdomen, very safe and comfortable for mom and for baby. And basically, we're going to get Vanessa laying down on her tummy. So, here we go. Perfect. And one of the things we have as well is this adjusting table, which allows us to use a patient's body weight and gravity to get the job done. So it makes it ideal for aligning the pelvis and balancing things out. Helps mom move better and feel better. And pelvis alignment is very important for giving birth in several weeks' time. So the more straight it is, the easier it will be. So I just set the tension specifically for the person laying on the table, just like that. The table is noisy, but is very gentle. All bark and no bite. Squeeze the knees together and relax. I'm going to get you on your right, or on your back. Let's piece up. And you go. Slide down just a little bit here. Perfect. Bring this leg up. Straighten that out. Hand back. This adjustment is helping with the rib cage. Some postural changes happen later on in pregnancy. Yeah, you are allowed to scratch your nose. And there you are.
Perfect. Thank you.
Do you want to share a little of your experience with the camera?
Sure. So basically very gentle, easy, quick, and you feel a lot better afterwards. So I'm excited. So I'm happy I'm doing this.
Awesome.
Thank you.
Thank you so much.
You're welcome.
And thank you.
Thank you. Don't mind me.